High blood pressure, also known as hypertension, affects over 1 billion of people around the world. Hypertension is a condition where the force of the blood against the walls of the arteries is consistently too high. It's measured by two numbers. The first number is the systolic blood pressure, which is the arterial pressure when the heart's contracting, and the lower number is the diastolic blood pressure, which is the arterial pressure when the heart rests between beats. Now, normal systolic blood pressure is defined as less than 120 mm of mercury systolic than 80 mm of mercury diastolic. According to the American Heart Association, or AHA, the blood pressure classified into two stages. In stage 1, hypertension is between 130 to 139 mm of mercury on the systolic side and between 80 to 89 mm of mercury on the diastolic side. Stage 2 hypertension is defined as anything that's 140 mm of mercury or higher on the systolic side and 90 mm of mercury or higher on the diastolic side. Typically, both systolic and diastolic pressures must be persistently elevated or fall in order to as hypertension, so the diagnosis requires at least 2 blood pressure measurements on 2 separate occasions. High blood pressure is a serious problem for the blood vessels that can lead to serious problems like myocardial infarction, aneurysms, and strokes. Hypertension can be classified into primary or essential hypertension and secondary hypertension. Primary hypertension happens without a known underlying cause, and about 90% cases of hypertension is primary. Risk factors for primary hypertension include old age, obesity, physical inactivity, family history of hypertension, diabetes mellitus, excess salt intake, smoking and alcoholism, and stress. Accepted age. All of these can be improved with lifestyle changes, and those changes can help reduce hypertension. Secondary hypertension occurs about 10% time there is specific to some other underlying disease condition. Some of these disease conditions include the following: primary hyperaldosteronism, Cushing syndrome, kidney disease, for example any factor restricting blood circulation to the kidneys, such as atherosclerosis, vasculitis, can result in hypertension. This is due to the crucial role kidneys play in regulating blood pressure. When insufficient blood reaches the kidneys, they release the hormone renin, prompting water retention. This increased water content contributes to higher blood volume in the arteries, resulting in elevated pressures. Additionally, various diseases can induce secondary hypertension is hyper and hypoparathyroidism, and certain medications including non-steroidal anti-inflammatory drugs, oral contraceptive pills, and steroids. Some patients refers to a situation where blood pressure levels are extremely high. A systolic pressure greater than 180 mm of mercury, or a diastolic pressure greater than 120 mm of mercury means is a hypertensive crisis. This crisis used broadly to encompass both hypertensive urgency and hypertensive emergency. Hypertensive urgency is a condition where blood pressure is severely elevated, but hasn't yet been damaged to end organs like the brain, kidneys, heart, and lungs. A hypertensive emergency is a more severe condition where extremely high blood pressure is causing acute organ damage. In that condition, emergency requires immediate intervention, otherwise the patient will have notorious complications, even death. However, the symptoms usually in primary hypertension isn't actually accompanied by any symptoms, which is why it's sometimes referred to as a silent killer. Most people with hypertension are asymptomatic, and usually found on routine screening programs or incidentally. Secondary hypertension might involve a variety of symptoms associated with the underlying cause, and finally hypertensive emergency might involve symptoms like confusion, drowsiness, chest pain, and breathlessness. The first choice for treatment of hypertension is lifestyle modifications including stress reduction techniques, losing weight, exercise, and controlling diabetes. In addition, there are a variety of antihypertensive medications that might be given. To control mild hypertension, a single agent is prescribed, but those who has stage 1 and 2 hypertension, drug prescribed in combination includes angiotensin-converting enzyme inhibitors such as enalapril and captopril, angiotensin receptor blockers such as losartan and valsartan, calcium channel blockers such as verapamil and amlodipine, diuretics such as chlorothiazide or spironolactone, and beta blockers such as propranolol or metoprolol. That's all about hypertension. I hope you found it helpful. If so, please like and subscribe to my YouTube channel. Thank you.